I've given several lectures and TV interviews on the global tobacco epidemic, and the good and the bad and the ugly have been the title of those talks. But today I'm going to focus 100% upon China and what's happening there. And to start with, I'm just going to very briefly go through the history of tobacco control in China, because I don't think that actually has been documented anywhere. Then I'm going to look at Sun Tzu, who wrote The Art of War, and see what he would have made of all our attempts, our fight in the tobacco battles. And then finally end up with a fairly condensed SWOT of really where China is today and what are the next steps forward. It comes as a surprise to many people to realize just how long the tobacco companies have been influential in China. In fact, it was really in the 19th century that they went to China with a vengeance. And at the time that this picture was taken in the 1910s, this was in Tianjin in the late 1910s. But there was also a report at the same time to say that the walls of Xi'an, and any of you who've been to Xi'an know these are pretty mighty walls. They're big walls, they're a huge area. They say you could hardly see the walls of Xi'an because they were bedecked by advertising from the transnational tobacco companies. So the transnational companies have long identified China. In fact, there's even a report that said that the CEO of the company that became Philip Morris was leafing through, he said, "Bring me a world map." And he leafed through it and he said, stop at this page. And he put his finger down at the bottom and it said population, whatever it was then. And he said, that is where we're going to sell cigarettes. And that was China. So the numbers of China are what have really attracted the transnational companies over the years. But I think it's worth pointing out that this started extremely early. And of course, as we know, in the 1940s, when the present regime took over, the transnational tobacco companies were kicked out of China. And the report is that British American Tobacco, as they had to leave in about 1949, what they said was, "We will be back." And indeed they are. And if you look at what happened 100 years ago and look at what's happening today, there's almost a rerun of history in so many ways. The bringing in of political influence, the advertising in China, battling with the local tobacco industry, the monopoly, to try and do them down. In fact, there's even a report that BAT bought up a warehouse of cigarettes from Nanyang Brothers, which was an indigenous tobacco company. And it humidified the warehouse so that all these cigarettes rotted. And then they, BAT, sold them on the market. And people thought, oh, you know, these just taste terrible. They used all sorts of tactics to try and get their foot in the door. So I think this is just a reminder, this slide, that this history goes back, in fact, a very long way. The health concerns also go back a surprising long way. In fact, it was in the 1970s that doctors in China first recommended taking action against tobacco. And I've just put down at the bottom to remind everybody that it was in 1964, the first US Surgeon General's report on tobacco. So this, in fact, is not long after that the health people in China were becoming alert to some of the problems. And in fact, the first national prevalence survey in China was done by the person who actually is really the grandfather of tobacco control in China, Professor Ung Xing-je in Beijing. He did this first national study, which horrified everybody. About 60% of men were smoking and about 5 to 7% of women. It was very much a wake-up call. It was published in Chinese and then in English. And I think it just alarmed the world to realize just how many cigarettes were being smoked in China. It didn't alarm, but it certainly pleased the transnational tobacco companies. Philip Morris in 1986 said no discussion of the tobacco industry in the year 2000 would be complete without addressing what may be the most important feature on the landscape, the China market. And even to this day, it frankly wouldn't matter if every smoker in North America quit tomorrow. If the transnational tobacco companies could capture the China market, if they could persuade Chinese men to smoke and their cigarettes, and if they could persuade Chinese women to stop smoking, it really would hardly matter what happens in North America because of the huge size of the market. And I'll remind you now, and probably remind you again later, that 1 in every 3 cigarettes smoked in the world today, 1 in every 3 is smoked in China, in one country alone. I mean, this is just quite a staggering statistic. And we will never address this epidemic globally unless we really focus down on China. Not only Philip Morris, but here you look at R.J. Reynolds Tobacco. This is in 1988, opening the first post 1949, the first post-joint venture in China with the officials and a dragon dance, and here they are with Winston going back in, just as they said they would so many years ago. Now, China has certainly done a huge number of studies. In fact, I would go as far as to say they've done not exactly too many studies. I mean, the need now is to move the information from these studies into action. But there were studies right back in the 1980s. And even, I mean, quite importantly, they did economic surveys even in those days. And what they found out was that the tobacco tax revenue was 4 billion and the costs of smoking was $5 billion to the Chinese economy. So very early on, this is really going back now 25 years, there were studies being done in China to show that tobacco was a debit to the economy and not a credit. And this was met with the most amazing resistance in China. The government, and particularly the tobacco companies, and even the ministers of finance somehow felt, with all this tax coming in, about a quarter of the tax revenue then for the government coming in, that somehow tobacco was vital to the economy. If they did anything on tobacco, then the farmers would suffer, the manufacturers would suffer, the income into governments would suffer. And in spite of these early studies being done, they somehow were just simply not believed. And I have to say, to this day, we struggle with getting the true economic information somehow believed at core within the corridors of power in China. Right through the 80s, they had the first international conference on smoking in Tianjin, in 1987, and I and several colleagues from the US attended this. It was a very interesting conference because it was considered then that tobacco was too sensitive to hold a conference in Beijing, that it had to be, so we all went off by train to Tianjin, down on the coast from Beijing, and we held the conference there because the government just was too anxious and nervous about having a conference there. And I think it's true to say that it was then that the plotting started in terms of really looking forward to China amongst the health, amongst the few of us overseas visitors and all our colleagues from China, particularly Professor Ung Xing-Jie again, who, as well as being an epidemiologist, really understood the need to translate epidemiology into public policy. We all started planning. We dared even dream about having a tobacco control law in China, and that was in 1987. But there were many, many studies done, all during that time. There were anti-smoking associations established in Shanghai and Hangzhou. There was a regulation on the control of advertisements. This kind of the idea of control was just starting. Forbidden to advertise cigarettes through broadcast TV, newspapers or periodicals. And that national law is still in place today, and I have to say works very well. The electronic and print advertising you really don't see in China. The problem was that things like the billboards, the sponsorship, the donations to the universities, all of those sorts of things were not included in that law. It was just print advertising and papers. From 1988 onwards, when World Health Organization held its first ever World No Tobacco Day, which has become an annual event, China celebrated that day with health education, trying to get people to quit, and has continued to do so ever since. I'm showing you these slides just to show that tobacco control is nothing new in China. It's actually been going on for a very long time. And in 1990, the Chinese Association on Smoking and Health was formed with the first national conference. We're in Beijing now, so that's a big step forward in those 3 years, with the late Minister of Health of China and several dignitaries from really quite senior political figures there, Dr. Chen Minjiang. And he gave wholehearted support to tobacco control in China. He was a very great man, in my opinion. So things were beginning just to move forward a bit. And they had an awful lot of different projects, particularly at grassroots level. And this was one in 1991 that I joined with my red scarf on, what was called the Rural Farmers Quitting Project. And we went off in a little minibus all around the rural countryside for weeks, and we would stop at different villages and talk to them about smoking, and we had these little groups of children who would sing for us, as it used to happen in those days. And it was in this village for the first time, and two things happened. One was an old lady who had bound feet came up to me, and I actually have never seen anybody with bound feet before. She came up to me, and I noticed her bound feet. In fact, took a photograph of them with her permission. But the second thing she said to me, "Are you Japanese?" And I thought this was a most extraordinary question, and I said, "No, I'm actually English." And it really didn't mean anything to her. And I said to the people from the Ministry of Health, "This is the most extraordinary question, am I Japanese?" And she said, well, she knows that you're not Chinese, but she said the only experience she has of anybody other than Chinese are Japanese, when the Japanese, in fact, came to China. So if you weren't Chinese, you must have been Japanese, and there was, you know, the rest of the world was not on her horizon. So I have to say, it's the only time in my life I've been asked if I was Japanese. The tobacco companies are still continuing to dream about China, to dream about calling it the limits of outer space, thinking about China's statistics. However, on the other side, there now was a law. The law of the People's Republic of China on the tobacco monopoly. One of the big problems was that we could only get a law in those days by putting it in the tobacco monopoly law. And the tobacco monopoly law, of course, was about the regulation of China's tobacco industry. In a sense, it was owned by the tobacco companies. But the only way we could get a law, there was no chance in those days of a standalone law on tobacco. The only way was to put clauses into this law. And it's caused one or two problems, as you can imagine, particularly with health warnings. We're in the bizarre situation to this day that it's the tobacco monopoly that have control over the health warnings. Anyhow, it enshrined in national law the need for research, the need for education on tobacco, controlling the ingredients, which China's done very successfully, bringing the tar levels down from about 60 to 80 to about 15, and they've now stopped, and also enshrining again this ban on print and electronic advertising. Philip Morris, this is probably the most sinister development of the entire liaison between the transnational tobacco companies and China. They signed a cooperation agreement in 1993, and they said it was an unprecedented level of cooperation, sharing of resources, including technology, people, and blending techniques. And what this agreement was for Philip Morris to work with China's national tobacco monopoly to prepare cigarettes for export. China still is not really exporting cigarettes, although it's beginning to, and that's another very difficult step for tobacco control in China. If they start to export cigarettes, it makes it more difficult to take action at home, because they're then open to the accusation, well, you're looking after your own people, and yet you're selling it to the rest of Asia in particular. But Philip Morris have been working very closely with them, and the result of that has been that this rather innocent monopoly, and innocent it was in those early days. It didn't advertise, it didn't deny the health evidence. In fact, I met with the monopoly people in China in the 80s, and they said to me, well, we hope, you know, smoking is abolished. And I said, well, that's rather what I hope too. And they said, well, if it's abolished, we'll just go and work for another government department. There was a feeling that they were just simply administering a state industry, and it could have been any industry. But the introduction and this liaison with Philip Morris have morphed it much more into a transnational. So what we're faced with today is that the national monopoly are getting very tricky, I would say, rather like the transnationals. They're beginning to advertise, and with some resistance as well. They're beginning to question some of the health evidence. They're beginning to talk to the government about not passing tobacco control laws, basically saying it would put people out of work, which it would not. So I think the result of this particular liaison between Philip Morris and China has actually had a lot of ramifications over the years. Again, more and more studies, many done by John Samet when he was at Hopkins, for example, but all sorts of things. More prevalent surveys, youth smoking, all manner of different kinds of studies were being done. In fact, as I said at the beginning, they've got a lot of studies. It just needs to be translated. And then in 1997, China hosted the first World Conference on tobacco, not the first World Conference, the first World Conference for them, but they hosted the 10th World Conference on tobacco health in Beijing. It was attended by Jiang Zemin, very senior sort of input into this particular conference. But even then, the tobacco monopoly were writing to Jiang Zemin saying, yes, you know, more or less you've got to go to this conference, you've got to open it, you've got to talk about the health hazards. But remember that in fact it's going to be devastating in economic terms to our economy and to our workers. I've actually seen, there was a letter that was supposed to circulate to 10 people and somebody translated it for me into English, and it's using the economic arguments to try and prevent Jiang Zemin really being able to give it a full blast. He was really told he should confine his comments only to health. But it was yet another step forward, and it was also another step forward for China, as I mentioned at a meeting earlier this week, because China asked me to help them. And I said I would do so under one condition, and that was gender equity. And they said to me, well, like, what does that mean? And I said, well, what it means is that half of all our invited plenary speakers had to be women, half of all the chairs of the sessions had to be women, half of all the committees had to be women, and that if we offered scholarships and funding to the low and middle income countries, then we would request that they put forward one male and one female. We realized we couldn't quite do the latter. And China said to me, this is absolutely impossible. No conference has ever done it before. The preceding 9, even in countries like the US and Canada, none of them had had gender equity. And I said, well, I mean, I'm happy to work with you. And in fact, it was a 3-year unpaid job, I might say. I'm happy to work with you and give you my all, but those are the conditions. And they accepted them, and we did it. And many people said it was the best conference we've ever had. So there's all sorts of little side stories about the history of smoking in China. On goes the economic research, economic burden of smoking in China, poverty in China, China at the crossroads, economics. Hu Wei from Berkeley has done exhaustive work on the economic situation in China. So it's not as if the leaders and the health people do not know some of the realities of the problems in China. And then a real highlight was that in 2003, China signed the World Health Organization Framework Convention on Tobacco Control. For those of you who may be less familiar with it, the FCTC is WHO's first ever convention. Since it was formed in the 40s, WHO has always had the ability, the opportunity to have a convention, like all of the other UN conventions, the rights of the child and environmental conventions and protocols and so on. But this, is, in fact, was WHO's first convention, and to this day it's one and only. China signed it the year that it really came in 2003, and ratified it in 2005. And I've just noted at the bottom, when we think about somehow, you know, the West has done it all and that the East has to learn, that's not quite necessarily true, and that the USA has signed but not ratified the convention. Signing it means they will not obstruct it. That's all that you are committed to do if you sign it. It gets you a seat on the table to go to all the meetings, but the USA has still not ratified it. We still obviously have got a long way to go, and this is a picture of the Beijing Olympics with all the patriotic messages, and yet somebody, you know, with a smoker in their mouth. So I think it sort of illustrates that we still have a long way to go at many levels in terms, in spite of the Olympics being a smoke-free games, we've still got a long way to go in terms of educating the people. The second part of this talk is really looking at Sun Tzu and his art of war. Now, the art of war is often quoted by business schools in terms of, you know, study the art of war for business practices. In fact, it's become quite fashionable to do that. But I would also argue that the art of war has many messages in terms of public health, and certainly as they pertain to China. They basically ask 4 questions regarding the outcome of war. Which side has got the stronger moral cause, which has got the advantage of terrain, which has the better general, and which has the superior army. First of all, which has the stronger moral cause? And I think there's absolutely no doubt that human health has to win, hands down, whenever you look at the strongest cause in terms of which side should win. The second, what about the advantage of terrain? And I would argue that the terrain is changing. I mean, for example, on passive smoking, second-hand smoke as it's now called, I think the whole climate of social acceptability of smoking is changing. It's certainly changed here in the US, but it's also beginning to change in China. What we heard, in fact, from Yudin about offering cigarettes to people in a social context or offering them at weddings. This is now just beginning to change. It's still got a very, very long way to go. But nothing is written in stone in any culture, in any country. I mean, the year that I was born in the UK, 81% of men smoked, and it's now down to 25%. It can change, and it will change in China. And it's just, I think, beginning to make that kind of change. So which has the better general? Well, we certainly know that the tobacco companies have extremely strong generals. And this is a picture, of course, of Dr. Margaret Chan, who is from Hong Kong, who's the Director General of WHO. These are their generals testifying, saying that smoking is not addictive. All of them under oath, I might say, and all of them basically lying. So I think it depends how you define better. If you talk about stronger, then I suppose it has to be the tobacco industry. But they're pitched against people who are basically interested in public health. And in many people's books, that would make them better generals. And then which has the superior army? We can see there's some very well-disciplined forces within tobacco control. And if you compare this is a picture from the early days of this sort of motley crowd of, you know, somebody who's a surgeon there, somebody who's a bit interested in public health. I mean, when we first started off fighting against tobacco in Asia, we were absolute innocents. There was virtually nobody working on tobacco control. These folk are from Australia and from some of the Asian countries. But you can see the difference between the well-disciplined forces of the tobacco industry and, as I said, this rather motley crowd of people, very innocently, in a sense, standing with their banners. And in fact, it's quite amazing how we had any victories at all when you come to think of it, when you see how the two forces were pitched in those early days. But what we also learned was that we do need support troops. And if we've learned one thing from the tobacco epidemic, is that this will not be solved in the corridors of hospitals and clinics. It will be solved in the corridors of power, particularly in China. But we need many support groups. Of course, we need the health people. But I've put up here finance people involved with budgets, customs official involved with smuggling, women's commissions, youth commissions, Friends of the Earth. We need to liaise with FAO about growing alternative crops in China. We need to look at litigation, and we certainly need health economists. If we need one thing in China, it's health economists to really try and make the government believe, which I still think they do not to this day, about the true economic impact of tobacco on their country. And that ranges from the use of land to grow tobacco that could grow food. And I would remind you, of course, as you will know, that China is now importing basic staples. It's importing grain. That has a political dependency as well as a very practical one. So, I mean, we're involved with a whole range of issues that certainly in my own medical training in Edinburgh in Scotland, nobody ever taught me how to, assess deforestation or to look at growing crops and things like that. We've had to learn a whole range of new skills, battling the tobacco industry on TV and things like that. If you look at Sun Tzu's battle strategies, they read just like a project proposal that any of you would put in. Measure the distances, estimate the expenses, evaluate the forces, assess the possibilities and plan for victory. And that's in fact what we should be doing. And I think looking at the last one, the plan for victory, I think if you're going to be a tobacco control advocate, you certainly have got to be optimistic, you've got to be realistic, and you've certainly got to be fairly robust. And finally, the third part, so to speak, if we look at a SWOT on China and just run through some of the strengths and weaknesses and opportunities and threats, I think the strengths in China are that the Framework Convention on Tobacco Control has been ratified. One strength is that the central government can, with political will, effect change very rapidly. I mean, for example, when they had the SARS epidemic, they had about 300 deaths in China from it, 300 in Hong Kong. What did China do? They built an entire hospital in a week. An entire hospital from nothing to an entire hospital in 1 week in Beijing for the SARS people. If they want to do something, they can do it in China and get on with the job. There are many now existing laws and regulations on which to build. They've been holding pretty much annual conferences now since 1987, bringing the tobacco control advocates in China together. And that's been, again, from the provinces, that's been a very important component of everybody meeting together and sharing experiences and so on. There are now some active organizations and people in China. CASH has now morphed into CATS, the Chinese Association on Tobacco Control. And it has moved, it's interesting, those early days when we went round doing these rural farmers quitting projects or school things, soft options in tobacco control. CATS now has become actually quite surprisingly sort of political, looking at economic issues. You may know or not know that the mayor of Shanghai recently went on television and thanked the tobacco companies for funding the China tent in the Shanghai Expo that lies shortly ahead of us. The tobacco industry was asked and did fund the China tent. So CATS, actually I have to say somewhat to my surprise and amazement, but gratification, decided to challenge this. So they challenged the mayor of Shanghai and they said it was a complete disgrace that the China tent was being funded by the tobacco companies. And to everybody, WHO, the Bloomberg people, everybody really had some input into this as well. And to our absolute amazement, the mayor backtracked. He went on to say he was very sorry, he could no longer accept tobacco money for the China tent and the Shanghai Expo. I mean, CATS has sort of moved from, as I said, the soft options of school programs into being a much more of an acute political force, dealing with some of the difficult issues like that. There are many people in universities, there's many very dedicated people. And one of the things that the Framework Convention has done is to actually sort of kick tobacco upstairs in China. Previously it was quite lowly, I'll come back to a slide on this later. Previously it was quite lowly, it was under sort of families, maternal and child health, and down there somewhere underneath all of these was tobacco. The Framework Convention has certainly kicked it upstairs in terms of its importance. Many data exist now, many data exist. In fact, I would just go as far as to say China does not need one more study that should prevent it taking tobacco control. Of course we need more studies. I mean, 10 years ago we didn't know of this very tight link between TB and tobacco. You need to do prevalence studies, you need to track the epidemic, you need to track what the tobacco industry is doing in China. But they do not need more studies to take action. They can take action right now on every bit of information that is available to China from outside, but also from their own studies inside China. The leaders now don't smoke, in fact, in public, and one big advantage is the low female prevalence rates. This, in fact, has moved from 7% to 2% recently. This is quite astonishing to us because Richard Peto and WHO and I, we sat down 25 years ago and we predicted a rise of female smoking in China. It has not happened. And we don't know why, whether the health education messages have somehow got across. And it's in spite of the fact that the tobacco industry are targeting women in Asia with messages of emancipation and glamour and Virginia Slims. It's in spite of the fact that women are more independent now in China and have greater amounts of money and more buying power, but they're smoking less. And we just are not quite sure why. But as you will know, it's still considered in China not very nice for a girl to smoke or drink or swear. Those kind of almost Confucian ideas are still obviously quite prevalent. But the same thing has happened throughout Asia. We have not yet really seen a rise of smoking amongst women in Asia. And I don't think that should make us complacent at all. If you look at youth studies, there's rather worrying influence that girls in Asia are becoming involved with that. And in fact, I often say at meetings, if you have one thing to do in public health globally that will save the most lives of anything, is to prevent a rise of smoking amongst Asian girls and women, because that would really translate into more lives saved, I think, than any other public health issue. So here we go. There was Mao, there was Deng smoking the heads off right throughout many decades. But you see the leaders now, not a cigarette in sight. They never, ever smoke in public now. You never see that. In fact, I'm told that most of them do not actually smoke at all, of the senior people. And as I said, the rates amongst women of smoking have decreased, so that what we're left with now in China are basically a very elderly population of female smokers at the moment, but we need to be vigilant. The weaknesses, there's quite a lot of weaknesses. In fact, I've got 2 slides of weaknesses. China is the largest producer and consumer of tobacco in the world. The Chinese government, in fact, is the world's largest tobacco company. It is bigger than Philip Morris. Many people are quite surprised to realize that. But it's a very big and a very formidable organization. Tobacco industry, as I've alluded to already, is seen as supporting the economy and employing large numbers of smokers. And there's very little tracking of what the tobacco industry is doing. Here we do it through the Minnesota documents, through researchers at university. Stan Glantz at UCSF is a terrier at keeping track of what the tobacco industry are doing in films and, on internet and things like that. There's nobody really in China doing a sort of detailed analysis of what the monopolies are doing in China, and certainly not what the foreign tobacco companies are doing. So here we can see graphically, this is from one of my atlases, the China National Tobacco Company is 32% of the world market. Philip Morris isn't even 20%. Of course, most of those cigarettes are not externally traded. Most of them are consumed internationally. But I think it shows you, it just reminds us that a monopoly is still the biggest tobacco company in the world, the Chinese government. I would also just say that there are about 44 countries in the world that still have monopolies, so they're not really exactly that rare. The leading producer of tobacco leaf, again, China stands out from the crowd. Every way you think of it, China stands out from the crowd. Its problems are the same as every other country. The product is the same, the health effects are the same, the obstacles are the same, what you need to do is the same. It's just of a greater degree of magnitude because of numbers than anywhere else. So the weaknesses are that until recently, as I mentioned with the Shanghai Expo, was probably the first time that very little tobacco control work was on the real cutting edge of advocacy, tax, economics, and smuggling. There's no standalone tobacco control law. There's bits here and there in an advertising law, in the monopoly law. But in fairness, as not many countries do have standalone tobacco laws. I suspect even in this country, they're fragmented into different laws as they've been passed. There's very, very little cessation being done in China yet. Most of the effort has been into preventing young people from smoking and looking at legislation, but very little help for smokers. And given that there's 320 million smokers, this in fact is quite a job, to the extent that you can't really start, even certainly one-to-one cessation should not be the priority of funding, but even starting up no smoking clinics. If you've got 320 million smokers and more, it would take 100 years to even begin to make a dent in that. So I think the solution to that lies in mass media programs and also in persuading those doctors, the health profession, who are smoking in front of their patients to stop smoking and to really start giving some quitting advice. There is a lack of public dissemination of research, and I think this is probably a really core problem. All sorts of people are doing research, and very good, very valuable. China itself, of course, is doing a huge amount of research, and yet it somehow isn't affecting the decision makers and the leaders in terms of taking it on board. We have a real disconnect between these two, and many male health professionals smoke. And here you are of a doctor in 1984 smoking in front of a patient, and they do so to this day. Those male smoking rates in China are very high, almost as high as in Russia, but you can see where the focus of male smoking lies in the world, and it's in Asia. Another weakness is the difficulty that the governments have in China to enforce laws, especially in remote areas. And I'm just quoting the Chinese saying that the mountain is high and the emperor is far away. Even if you pass a law in Beijing, it takes quite an effort to make sure that this is actually being implemented at a local level in Sichuan or somewhere like that. But there are opportunities. I think the Framework Convention on Tobacco Control is the moment of the opportunity to change social norms of smoking. Tobacco is now on a higher level agenda. China also wants to take its place on the international stage now. And every country in the Western Pacific has ratified this convention. There is a reporting back system through a conference of parties every year or 2 years, where countries have to go back and, in a sense, report on how they're doing and what they're doing. And I think China would not like to be seen as somehow falling behind in this process. I think there is an opportunity to encourage China to hold its head high amongst its neighbours, never mind the rest of the world. The Olympics in 2008, in spite of that man with all his Olympic gear on smoking a cigarette, was remarkably successful. This came through a Bloomberg grant. And basically, what did that mean? It meant that the venues were all smoke-free. In fact, if you went into the various venues, you would get text messages on your mobile phone saying, this is a smoke-free venue, you know, please quit smoking. There were messages on the screens. The taxis and the public transport in Beijing went smoke-free for the duration of the Olympics. Many hotels, the public rooms went smoke-free, and they had smoke-free floors for the first time ever. And we trained hundreds of volunteers as to how to talk to people if they came upon a foreigner, in particular, smoking in an area that we're not supposed to be smoking. And our job at the moment is to try and make sure that all of that advance is continued into some kind of municipal or, in fact, even national law would be better. The trends are interesting. For the first time in the last prevalence survey, for the first time ever, there are just a few ex-smokers on that 60% of men smoking. There is now the understanding that smoking is harmful, not the understanding of how harmful, but most people in China now know it's harmful. And there's just that little tip over the top of that curve. And it'll be the next prevalence survey will be very interesting to see if that is maintained. And the other interesting thing is that the tax from tobacco used to be about 24% of government revenue, and it's now down to 7%. Only 7% instead of about 24%. And the reason for that is China's exports. They're exporting to you folk here in America. And because of that, they're getting more tax in from exports. So even though the tobacco companies are still making money, the percentage of the tax that's going to government has in fact gone down quite dramatically in the last 10 years. Whether that makes them less powerful or not, we can only hope. I've mentioned the opportunity of the FCTC, and you can see here that I've showed the football being kicked upstairs, and that's to show how tobacco control has been kicked upstairs by in the Chinese government. And you'll see from the map that the only two big countries that have not ratified the FCTC, and they're important for different reasons. One is Indonesia, because of its massive population, and the second is the USA, because of its influence and because it hosts Philip Morris and some of the other tobacco companies. The main provisions of the FCTC, as I said in an earlier talk, are just like a good national law. You ban advertising, smoke-free areas, put up the tax, do education, do research, and so on. It's not difficult to understand, but it enshrines it in a sort of national commitment to a UN treaty. And I think that really, as UN treaties do, slowly, sometimes not too surely, but at least they drive the process forward. And linked to that, we now have this mpower, which is linked into the FCTC in terms of practical things that countries can do. If we look at opportunities again, the WHO China office is now active on tobacco control, very active. And as part of the Bloomberg project, both all the regional offices and also 15 country offices, including China, have got a designated, dedicated tobacco control person. 10 years ago, I'm not sure there was any WHO office that had a full-time person working on tobacco control. So that has changed. The World Bank in China has now re-engaged on tobacco control issues. We now have donors. We now are thinking of partners in China. The Ministry of the Environment, could they and would they help with indoor air issues? That is yet to be explored. And in civil society, there is certainly the growing awareness of the harmfulness of smoking. So where do we stand in Hong Kong? We stand in a sort of slightly sensitive position. We're in a sensitive position anyhow, but we stand in a sensitive position with tobacco control because we have really done so much. We have banned smoking just about everywhere you can think of, including, for example, our gazetted beaches and our outdoor parks. Certainly all our workplaces, restaurant, bars, mahjong parlours, bathhouses, shopping malls, everything, they're all smoke-free. And we banned almost 100% advertising. We've even banned the placing of an advertisement from Hong Kong up onto the internet. We've actually done a huge amount with a lot of government support and a lot of support from the community and researchers and the universities. All our materials are in Chinese. What we have shown is that a Chinese city can do this. They can, in fact, do tobacco control, and they can do it effectively and make it work. And I think that one of the good bits of news is that our Ministry of Health is very close to the Ministry of Health in China. They meet, they're friends, they engage each other, they do discuss tobacco, because our Minister of Health in Hong Kong, York Chow, has been excellent. He's firmly dedicated to tobacco control, and he has direct access to the people in China. So I think what we must not do in Hong Kong is to boast in any sense, or to say, look, you know, what we've done. Absolutely not at all. That would just rightly irritate China to see that. But I think we do have opportunities. We even have about 30 members from Hong Kong who are on the National People's Congress in China. I've just suggested to our government that when I get back from this meeting, you know, wouldn't it be a good idea just to meet with them, brief them on the FCTC, not ask them to do anything, just brief them on tobacco, on the FCTC, so that when they go up to the National People's Congress in China, that they are at least well informed about tobacco issues. So I think there are some windows of opportunity with Hong Kong. And now, as I've mentioned, we've got major donors. First of all, Michael Bloomberg, and Bill Gates has now joined it to give serious money to tobacco control in the lower middle income countries. I worked for 25 years for no pay at all because there was nobody to employ me. There was no career path, no funding, nothing for tobacco control in Asia. But we now have that. We've actually got funding for posts, we've got regional offices, we've rolled out a grants program, and it's meant really quite a professionalization of tobacco control over the last 4 years that we have simply not seen before. And Bloomberg in particular was basically the first large philanthropist to really understand that it's the non-communicable diseases that are killing the world. 75% of deaths now. Just about 75% of deaths are from the non-communicable diseases. One of the things that the project has done is to try and take all of these PSAs that have been evaluated and to try and just turn them into different languages and just help countries getting started so that they shortcut both the expense of it and also some of the expertise. There are now about 30 countries in the world that have got graphic health warnings. I know the US does not, but more and more are really doing this week by week almost. And we've now had them since 2006, which is for 4 years. And again, China's quite interested in Hong Kong's health warnings because of what they are and what they say. And of course, as I mentioned earlier, we're in quite close cooperation with China. But there's still, 160 countries in the world do not yet have them. So what are the threats? I think the threats are the lack of awareness of the degree of risk. This little box at the side that I'm not sure if you can read says only 4% of both smokers and non-smokers in China know that smoking causes heart disease. I used to say that there were millions of people in China who did not know that smoking was harmful. I think that's changed now. I think everybody does. But what they don't know is that it kills half of them. They sort of think it's like a great many risks in life and in society. It's the magnitude of the risk, the 50% death rate. I don't think that is very well known. There is this preoccupation with other diseases or non-health problems like the banking crisis and things like that. Ministers of finance in particular are blinded to the economic debit. They see the tax coming in, but they still need so much to be convinced. There are the lack of funds. The focus of the health profession on curative medicine, I would say, is also worldwide. This is not just China. Even in America, where do the funds go? They go into curative medicine. They don't go where they actually belong in a proportionate sense into public health and prevention. Some people see smoking as a personal behavior. It's cultural, it contributes to social harmony, and then, of course, as we know, there's the tobacco industry. Now, even in Hong Kong, this was at the height of our SARS epidemic, even in Hong Kong there is a misunderstanding of the degree of risks. Here you have got a guy who's, on my side, has got a rather big belly, drinking beer, smoking cigarettes, and yet the risk this man perceives in the blue shirt is that his big risk is SARS. He's got his mask on because of SARS. So trying to get across magnitude of risks to people, even in a relatively sophisticated place like Hong Kong, is really quite difficult. We struggle with that all the time. And then the final threats are from the industry themselves. There are now threats from the national tobacco companies. They're very strong, contributing to state taxes. They're increasingly exporting cigarettes and challenging the health evidence. And the transnational companies are even greater worry with their joint ventures, helping the monopoly produce cigarettes, or even helping them with this web page, Tobacco China Online. It's a very insidious influence. And they're also producing these new tobacco products that are causing us so much headache as to how do we classify them and what do we do. So what are the next steps for China? I think firstly there has to be the ratification of the FCTC, the implementation of it. They've ratified it, there's an implementation, and almost everything is contained in the FCTC. I don't need to go into those details again, and also mpower. We need continued research and monitoring, not to stop action, that can go on. There are some ideas like linking tobacco to the NCDs in Healthy China 2020 plan, certainly raising the tobacco tax and making that price go on to the cigarettes, banning promotion, extending the smoking ban, having pictorial health warnings and then plain paper packaging, providing cessation and advice, tackling smuggling, counterfeiting. A formidable list of things to do, to tell the truth, a formidable list of things to do in China, but also whether there is an opportunity in a rather more philosophical way of linking tobacco control with Confucius and Sun Tzu. Certainly, as you will know, Confucius is having a bit of a reawakening in China, and whether we can portray tobacco control as a just and noble cause in China, we would hope so. So I will finish with a slide I've shown in some of my earlier sessions of this little boy in China, this toddler, in fact, in China. And I'll just run through these slides, one after the other. He's there smoking like a little pro. And there's many pictures of children smoking in China. The grandfathers give it to them. It's thought to be cute. It's thought to be funny. I mean, this is the kind of problem that we're up against. And this is the kind of thing that we're working for, to free these children to grow up smoke-free. Thank you.